let me welcome on board Ms. Suneeta Reddy, the MD at Apollo Hospitals, joining in on the show right now. Ms. Reddy, thank you so much for your time today. How are you rating the budget? There was a big cheer here in our newsrooms itself when the income tax, concessions were announced, and clearly giving more money in the hands of the consumers. That's what the economy, I guess, needed.
Yes, you're very right. I think what's good for India, creating more disposable income, is very good for healthcare because this will give them access to great healthcare, and through many ways. One is that they can access private insurance products, and therefore come to hospitals, both corporate and those who are private nursing homes. So this clearly creates access for the common man to healthcare institutions. But there are different parts of the budget which I thought was not just rhetoric, but very good for the country. One of them being the focus on cancer. The growth in cancer has been over 7 to 8%, and acknowledging the burden of the disease by reducing duty on life-saving medicine is really something that is very welcome. And I think that moving on, the fact that they've also created 200 centers for daycare and chemotherapy is a recognition that this is a much felt need. What needs to be done to make it more comprehensive is to create that hub and spoke model between the hospitals with the repository of knowledge, so that we can spread it to the districts, and also relook at the customs duty on medical equipment required to treat cancer, which is linear accelerators, etc. Because duty on that is around 28 to 36%. So I think the next step would be to look at those duty components to really make it very good for people with oncology and the rising incidence of cancer in the country. The second thing, of course, is the focus on Heal in India, because this is Heal for India as well. As we think of the opportunity here, it's $100 billion opportunity worldwide. And I think India deserves the right to own this space. And because we do it, our clinical excellence comes at 1/10 of the cost of any other foreign country. And having achieved these milestones, I think we really have the opportunity to gain large market share, earn foreign exchange, as well as create jobs for people. Finally, just looking at the supply side, which for us is very crucial, doctors and nurses, and having that the focus on creating 10,000 new seats in medical colleges, moving to 70,000 is much needed. And I would say that these volumes have to increase both, not just in medical colleges, but nursing and paramedics. So skilling is another area where there was a mention, but I think that we have to deep dive and see what more we can do. But on the whole, a very good budget for healthcare, a very good budget for all Indians.
Oh, yeah, absolutely. And I was just going to ask you, because the outline has been shared by the finance minister for the healthcare sector, but how much are you upping your own capex by at Apollo Hospitals? Because I'm sure you're hitting the ground running already.
Yes, we are. So clearly, we've allocated 6,000 crores for expansion, and we will add over a period of 4 years another 20% capacity. And most of this will come in Tier 1 cities where connectivity is really good. So I think, foreign exchange earnings for this hospitals in the hospital space should go up.
Okay, good luck with that. And thank you so much for your time today.